Okay, all right. We're back from the break. So next we will be discussing vaccines. And it does sound like there is a lot of interest in speaking about this topic. And I think vaccines are amazing tools that doctors and public health teams have to prevent serious illness. So we'll talk more about vaccines in general and specifically the COVID vaccine. So next slide, please. All right. So how do vaccines work? The truth is, there are many types of vaccines that work in a little bit different ways, but in general, they have in common that the vaccine teaches the immune system how to attack an infection. So here's an example using my favorite Sesame Street character, Cookie Monster. So let's pretend that the infection is a chocolate chip cookie. The cookie is the infection, and that Cookie Monster is our immune system. So here, the vaccine would be this kid with a picture of chocolate chips. So Cookie Monster is shown the picture of the chocolate chips, and he remembers the chocolate chips. When he sees the cookie with the chocolate chips, he's trained to destroy it very quickly. Next slide, please. The Pfizer and Moderna vaccines do work in a similar way. So these vaccines use a special mechanism using genetic code from a messenger RNA, or sometimes we just call it mRNA. And the mRNA is a genetic code that tells your body to make proteins. So think of mRNA from the vaccine as a special recipe or message for your cells to temporarily make spike protein. That's that protein that Dr. Frank told you about. So going back to our last example, imagine the picture of chocolate chips as the mRNA and Cookie Monster as the immune cell learning how to destroy it. Now let's take a little bit closer look at that image that you guys see there. So the graphic. So the first step is injecting the vaccine with the mRNA into the system. Next, the mRNA enters the cells and tells them to produce that spike protein. And then step three, the immune cells see the spike protein and start to build defenses against that spike protein by making antibodies and activating those special immune cells called T cells. So then if COVID-19, if the SARS-CoV-2 virus infects somebody, then the antibodies and the T cells will be triggered. They'll be ready to go to fight the virus very quickly. Next slide, please. Okay, and so a lot of you guys might be wondering, so what are some of the side effects for a vaccine, for this vaccine in particular? And most of you have heard about the COVID side effects in the news, or we're talking to family members, friends, or if you know anybody that's received the vaccine. So the truth is that most of these that these are the most common side effects, and they probably sound somewhat familiar, right, from maybe other vaccines that you have received. So when I got the vaccine, for example, I did get the sore arm, fatigue, headaches, muscle pain, and nausea for about 2 to 3 days. It went away abruptly, and it was all worth it for the protection. The side effects are one way for your body, excuse me, the side effects are one way for you to know that your body is learning how to recognize COVID. But I do have some patients who just don't have any side effects at all from the vaccine, and that's okay. The vaccine would still be working in that case. Next slide. So one known rare side effect of the COVID vaccine is anaphylaxis. Anaphylaxis is a severe allergic reaction that includes some of the symptoms that you see in this slide, like the swelling, trouble breathing, vomiting, the hive type rash, a combination of those symptoms. This side effect is rare, and if it does happen, it usually happens within 15 minutes of somebody getting the vaccine. And this is why we observe people for 15 minutes after getting the shot. That being said, if somebody has had a reaction like this to something else, it does not mean you can't get the vaccine. You should still be able to get the vaccine, but it's good to let the vaccinator or your doctor know that you've experienced this before. Just something I wanted to add here, and you guys may have heard in the news about this, but there is also a possible side effect of clots for one of the vaccines, the Johnson and Johnson vaccine. and there is currently a pause and review for this vaccine. But it is important to remember this potential side effect is very, very rare so far, and that we will be getting guidance if we have to make any changes. Next slide. Okay, so I did want to get Dr. Frank's help here, and maybe you guys can answer this question. So, who does everybody think should not get the vaccine? What do y'all think? Okay, so here we see some of the responses. So people with certain illnesses that weakens their immune system, or does, kids younger than 7, kids, we don't know how they would react to the vaccine, children, hmm babies, those who've had, yeah, you guys bring up some interesting points. So um, we can move on to the next slide. Those are some really good responses. So really the only contraindication at this time, so the only people we know that shouldn't get the vaccine are those that we know have had anaphylaxis to the first dose of the COVID vaccine. Okay, so that's the only one that we know currently. On top of that, just like many of you guys mentioned, the vaccine is approved only for those that are 16 or older, and the the pharmaceutical companies are looking into how safe the vaccine is for younger patients. But so far, the initial data looks good, and we're anticipating that it would be approved for younger patients as well. All right, so the reality is that everyone else can get the vaccine. So this includes people that are immunocompromised, people with asthma, pregnant women, allergies, diabetes, high blood pressure, liver problems, and the list goes on. Pretty much everyone else can get the vaccine, and we want them to get the vaccine so they can get that protection. Sometimes when they have some of these other conditions, they're at higher risk for more complications from the disease, right? From COVID, and so we want them to have the protection from the vaccine. Okay. All right. Next slide. So you guys have heard of the three types of vaccines that we have, right? So there are three currently available, and so this will give you guys a chance to choose which one should you get. I don't know if we could see the responses. Okay, good. So yeah, definitely a variety. Um, a lot of you guys are choosing the Pfizer one. Um, all right, we can move on to the next slide. Okay, great. So, um, like we mentioned before, the vaccine is approved for 16 and older, but really the only one that's of those three that is approved for patients 16 and older is the Pfizer vaccine. Okay, and there is good news. So, there already has been a request by both Pfizer and Moderna to request approval for kids 12 to 15. So again, we're hoping all of that will continue to expand. All right, and if you move on to the next slide, really the best vaccine. I know we just talked about the pause on Johnson and Johnson, and the reality has been it's just a very small number. It's only been 6 patients who've had the side effect of the many, many, many who've gotten the vaccine. So we'll learn more about that. But the reality is that all three of these vaccines are very good. Okay, so our recommendation is to choose the vaccine that you can get the fastest. So all of these vaccines have been shown to be 100% effective at preventing death from COVID. And just like it says in that box there, the best vaccine is the one closest to your arm. So I personally did not get to choose my vaccine when I had the chance. Um, I got Moderna, but that was the one that was available, and I was happy to get Moderna. But I would have been happy with any one of those three. Okay, and that's what I've been telling my patients and my family members that let's get the first one that you can get. All right. So, um, Dr. Frank, I'll ask for your help here too with any other questions. There is already one question that I can get started with. So, someone asked, can someone with the vaccine still get COVID? And the answer is yes, but that chance is much, much lower. Somebody can get COVID after they've gotten the vaccine. But the important thing to remember, just like we talked about, that the COVID vaccine protects against severe illness and death. All right, there has not been one single person that has gotten the vaccine and is fully protected that has died from COVID, and that's really important to remember. All right, do we have any other questions?
They are coming in.
Okay. All right, and Dr. Frank, feel free to chime in too on any of these questions.
Sure. Um, yep, I'm just gonna wait till we have a few more. Oh, so one is, do you know when kids 13, ages 13 to 15, will be able to get the vaccine?
We don't know yet, but the good news is that process is going. So like we were just talking about. So there was a request for emergency use for kids 12 to 15 from Pfizer and Moderna. So we're hoping to hear soon about that. I can't give you an exact date, but we're hoping. Earlier they had mentioned maybe by the summer, but we're hoping it's even sooner than that.
After getting vaccinated, what should you do other than still practice distancing?
So the CDC is putting out guidance about what to do, but overall, we do ask people to still wear a mask, right? We still ask people to distance and do all those things. And there will be certain scenarios where maybe you don't have to wear a mask, where you can give family members a hug and things like that. And it really depends on the situation. For example, if there's somebody who is at higher risk, maybe has a medical problem where it'd be really bad if they got COVID, then we would want to just be extra safe with them. But overall, we still want people to be safe and practice those measures as much as they can, with just allowing yourself to do certain things depending on what the CDC. And if there's confusion about these things, you can always talk to your doctor as well.
Why does Johnson and Johnson take one dose while Pfizer and Moderna take two doses?
That's a very good question. So a lot of these decisions are made based on experience with similar types of vaccines, and then the data that they look at. And so they were comfortable at Johnson and Johnson doing the one dose, and seeing that they did provide good protection compared to the two doses. And so for Pfizer and Moderna, they did similar look in their at their data, and they saw that two doses worked the best. And so I don't know if there's anything you would add, Dr. Frank, related to this question.
Mm-mm, that covers it. The next question is the vaccine obligatory? Do I have to get it?
No, currently the vaccine is not obligatory. You do not have to get it. It is a choice that you have to make, you and your family. And that's part of the reason why we're here. We want you guys to have all the information so that you can make the best decision for you and your family. And we understand people have questions, they're anxious, they get their information from different sources, but we want you guys to get information from us too. And we do highly recommend the vaccine. You know, I recommend it to my mom, my sister, my, pretty much anybody that qualifies for it right now. I do highly recommend it. And so it's not mandatory, but it is highly, highly recommended.
What vaccine is the most effective in California?
So, like I said before, the most important thing to look at is how effective it is at preventing death. And they're all 100% effective at preventing death from COVID.
Which I just want to add, that's amazing. Like, that's a really, really good vaccine. Like,
Yeah.
we weren't actually expecting it to be this good. And so, those of us who work in the medical world are just so thrilled at how good of a vaccine it's turned out to be.
Yes, absolutely.
When is the AstraZeneca vaccine going to be approved in the US?
That's another good question. I actually don't know when it might be approved. I don't know if you have any information about that, Dr. Frank.
I don't know either. I don't know why we haven't approved it. And so I that's a great question that we'll need to look into more.
One thing I have read about the AstraZeneca vaccine is we do have doses of it in the United States. and we are sending them out to other countries to help.
Before we move on to talking about COVID and COVID disparities, are there any other burning vaccine questions? No question is a silly question. If you're wondering about it, someone else probably is too.
Dr. Frank and Dr. Rivera, there's a question in the Q&A, and I think the question is, what if a student knows someone who got the Johnson and Johnson vaccine?
I would say that's great.
Mhm.
If they have a headache, like a really bad headache, or if they have like a new pain in one of their calf muscles, anytime that happens, I would tell them they should see the doctor. And that's true, especially if they got the Johnson and Johnson vaccine in the last 2 weeks. But I don't think anyone who's gotten it needs to panic.
Okay.
Honestly, if they've gotten it, that's great. That means they got one shot. They're building their immunity to COVID. Like
Right.
that's awesome. They don't need to panic.
Yeah.
Anytime someone gets a really severe headache or like a cramping that's pretty bad in one calf or really severe belly pain with or without a recent vaccine, they should call their doctor to be evaluated. Anything else you want to add, Dr. Rivera?
Yeah, I mean, it's also important to remember that COVID itself, the disease, also, I mean, that definitely we know can increase your risk for clots and has other complications. So, um, just to point that out as well.
All right.